Hello and welcome. In this video, I'm going to talk about fat grafting for the face. Fat is an unmatched filling material and has impressive regenerative capacities, providing an unmatchable restoration of texture and skin quality. Welcome to Faces, your medical and surgical guide for the head and neck. Fat has extraordinary regenerative capabilities because it carries a large variety of growth factors. It is an excellent choice for facial scars management, facial volume deficit reconstruction, improvement of skin quality after radiotherapy, and facial wound healing. Fat is readily available and host compatible. The small amounts of fat needed for facial treatments can be harvested easily and more than once if needed. The regenerative capacity of fat provides possibilities to restore volume, texture, and skin quality not easily achievable by any synthetic fillers or other synthetic products. The amount of fat needed for facial procedures is small, usually not exceeding more than 50 to 60 cubic centimeters. I usually prefer doing the procedure under general anesthesia for the comfort of the patient. Also, it allows using fewer amounts of anesthetic solution in the donor area with less disruption of fat cells. In my practice, fat around the belly button is for me the primary source of fat. Thigh fat can also be an option. Grafting starts with very small incisions, leaving almost invisible scars. This allows the cannula to access the fat tissue. A solution is injected, and the fat is aspirated with the cannula. The tissue goes through filtration and processing with different methods according to the final desired effect. Small incisions are performed at the facial recipient area, and fat is placed according to the final desired shape. Recovery from fat extraction around the belly button is usually very fast and tolerable. During the first 5 days, you will be asked to use an elastic band around the donor area and avoid strenuous movements for 2 or 3 weeks. At the recipient area, during the first 4 to 6 weeks post-operative, there will be hard swelling that will progressively turn into soft, natural tissue. Bruises should be gone by this period as well. The main disadvantage of fat is resorption. This occurs during the first 3 months after surgery. The rate is dependent on each patient, but general values of resorption go from 25 to 50%, which can be even higher in hypermobile areas such as lips and nasolabial folds, or ill recipient areas such as scars. This means it may be necessary to repeat the procedure after 6 months to obtain the desired result. Once grafted, the remaining tissue is stable, naturally aging throughout the ears harmoniously with the rest of your facial structures. So you've seen the potentials of fat grafting, the technique, post-operative care, and the risks you need to keep in mind. Thank you for watching this video, and I hope you feel a bit more informed about fat grafting for the face.